it's clear that a lot of people have become well enough, have enough money to be happy and to have an affordable healthcare system, but at the same time, certainly 10% of the people have a huge problem with access to the healthcare system, especially because everybody has to pay every year, at least when he wants to get to the hospital, €335, and this will continue year after year. So for poor people, the 10% poor people, for them it's really a big problem, and they avoid the healthcare system because they have to make those relatively small expenses, but they can't afford them. That's one part, and the other part is that at least 300,000 Dutch citizens are obliged. Everybody Dutch citizen is obliged to have an insurance. The insurance company he wants to choose, he is free, but 300,000 of them have not the money. They don't get into insurance company, so they do not have access to the healthcare system because they are not insured. And this is also a huge problem. So living in poverty, living in stress, has a big influence on people. And you know, everybody in the Netherlands is stating, all scientists are stating that if you are rich, you will live 7 years longer than when you are poor, and you will live not only 7 years longer, but 7 years healthier longer. So every scientist is saying this, and at the same time, we do not do enough for the people on the poor side of the country to help them to get out of this stress, poverty gap, poverty trap.
There's two sides of this. One, of course, is the therapeutic, treating patients, but also the prevention side, and which is often forgotten. And this is a key issue for Ireland when we look at the area of screening and the cervical issue. Identifying patients at an earlier stage so they can get a better treatment at an earlier stage. And a key issue there is reimbursement, but reimbursement for diagnostics. So as we want to identify patients at an earlier stage, often the diagnostic side of it is not reimbursed. The therapeutic side is reimbursed, but not the diagnostic side. And the question is, how can we incentivize the diagnostic and the biomedical community to reinvest in diagnostics so we can identify which treatments will work for patients and which treatments will not work. And this is a key issue for Europe, to look at diagnostics more than, say, just solely on therapeutics, which is often overemphasized. And the other side is not to focus solely on therapeutics or diagnostics, but also healthcare professionals. Healthcare professionals need better information and knowledge how to treat patients and to speak to patients so they're able to take their treatments, and if their treatments need to be changed, then they need to be more personalized. In China, they say if you can keep a patient healthier for longer, then the doctor is paid. But if a patient gets sick, then they don't get paid. So the challenge for the healthcare system is how to treat the right patient at the right time, which is a nice catchy phrase. And often the discussion is around these expensive therapies. But treating patients later, of treating patients with the wrong treatment, that costs a lot more to healthcare systems. So if a patient gets lung cancer or gets a cervical disease, then the question is, then that's a huge cost burden to society. So of course these treatments are expensive, but the question is how to avoid a bigger burden for the healthcare system for later.
Well, it's very important that we first of all talk together and that we have clarity of aims. And the aims, of course, are the same in all the countries. I mean, there is nothing special. There are special things to do with immigrant populations and hard to reach groups in individual countries, but the public health and their health issues are actually common to the human situation, and we should start from that. We really need clarity of thought about what the objectives are, and it's no good just throwing money at it. There has to be enough money to meet the objectives, but you have to know what your objectives are. That's really, really important in my view. Public health is now becoming ascendingly important, and the public health is important for the individual and for the community, and together, if it fails, and we've seen that now in vaccination policy, we know what a disaster that can be. So public health is crucial. And the other aspect, which isn't thought about enough of, is education. And it's education of the citizen, of the patient, and of the workforce, and appropriate education within the workforce itself. And we haven't really concentrated on that properly yet in medical schools, nursing schools. There are challenges there, believe it or not. In terms of the workforce, in terms of influenza vaccine, of doctors and nurses looking after patients with influenza, is appallingly low. And this really does need addressing. So education at all levels is crucial, and I hope that makes these hard to reach groups much more accessible, and realise they're not being threatened, they're being helped. I'm both an academic and a clinician, and I'm proud of that. I think the academic side of medicine can contribute to this clarity of thought and dissect out questions which need answering. And so I'm a great believer in the contribution of academic medicine to public health and to the health of the nation. At the same time, we have to have a workforce, and academic life, of course, teaches, and so there's a big teaching responsibility to the workforce. And then, as I mentioned already, we should be thinking about education all the way through society, so people are informed and they know where to go, what health facilities there are, and how to access them, and not be afraid of medicine, to realise that medicine's there to help both the individual and the community, and not to be frightened of it.